Vital signs taking. Preparatory phase. Check that all equipment is functioning normally. Performance phase. Introduce self and verify the client's identity using agency protocol. Explain the procedure to the client. Perform hand hygiene and observe appropriate infection control procedures. Provide privacy. In taking the temperature, place the client in the appropriate position. For oral, axillary, tympanic, temporal, it should be sitting or supine position. Wipe the electronic thermometer from bulb to stem using cotton ball or soft tissue in a rotating motion. Then, switch on the thermometer. When taking the temperature through the axilla, first pat the axilla dry if very moist. Then, place the bulb of the thermometer in the center of the axilla. Wait the appropriate amount of time. Electronic thermometers will indicate that the reading is complete through 3 light or tone. Remove the thermometer and wipe with cotton or tissue. Read the temperature and record it in your worksheet. If the temperature is too high or too low or inconsistent with the client's condition, recheck it with the thermometer known to be functioning properly. Peripheral pulse. Select the pulse point. Normally, the radial pulse is taken. Place 2 or 3 middle fingertips lightly over the pulse point. Assist the client to a comfortable resting position. When the radial pulse is assessed, the client's arm can rest alongside the body or forearm can rest at a 90-degree angle across the chest. Document the pulse rate. Pulse rate unit of measurement is beats per minute. Measuring the respiratory rate. Place the client in the appropriate position. Place a hand against the client's chest to feel the chest movement with breathing and observe the chest movements while supposedly taking the radial pulse. Count the respiration in 1 full minute, inhalation and exhalation as 1 respiration. Document the respiratory rate. Respiratory rate unit of measurement is breaths per minute. Blood pressure measurement. Make sure that the client has not smoked or ingested caffeine within 30 minutes prior to measurement. Position the client appropriately. For adult, it is sitting unless specified. The elbow should be slightly flexed with the palm of the hand facing up and forearm supported at the heart level. Then, expose the upper arm. Wrap the deflated cuff evenly around the upper arm. Next, locate the brachial artery and apply the center of the bladder directly over the artery. For adult, place the lower border of the cuff approximately 2.5 cm or 1 inch above the antecubital space. Perform a preliminary palpatory determination of systolic pressure. Palpate the brachial artery with fingertips. Then, close the valve of the bulb. Pump up the cuff until you no longer feel the brachial pulse and note the pressure on the sphygmomanometer at which the pulse is no longer felt. Then, release the pressure completely in the cuff and wait for 1 to 2 minutes before making further measurements. Cleanse the earpiece with antiseptic wipes and insert it into your ears. Place the bell side of the stethoscope over the brachial pulse. Take note, it should be directly on the skin and not on the clothing. Pump up the cuff until the sphygmomanometer reads 30 mm mercury above the point where the brachial pulse disappeared. Release the valve on the cuff carefully so that the pressure decreases at the rate of 2 to 3 mm mercury per second. As the pressure falls, identify the manometer reading. Deflate the cuff rapidly and completely. Repeat the steps 9 to 11 to confirm the accuracy of the reading, especially if it falls outside the normal range. If it is client's initial examination, repeat the procedure on the client's other arm. There should be no difference of no more than 10 mm mercury between the arms. The arm found to have higher pressure should be used for subsequent examination. Remove the cuff and wipe the cuff with an approved disinfectant. Document and report pertinent assessment data according to agency policy. Then record blood pressure. The unit of measurement for blood pressure is millimeter mercury.